So at the Facial Rejuvenation Clinic, we've got over 15 years of experience in all aspects of treating cosmetic appearance medicine. Now, cosmetic appearance medicine has many players in the field now, and to the uninitiated it seems very complex, as there are so many different ideas on what certain people should be doing. But essentially it's easy to break it down into really three classifications or types of treatments that address different areas of skin. And it's essentially very simple. Changes in complexion really only affect the top 1 to 2% of the thickness of our skin, and that's what we call the epidermal layer. And these are changes with pigment or sun damage or certain red conditions or fine lines or pores. And that's really what we treat with certain skincare and certain facials. But nowadays most treatments are much more efficient and effective if we use some of the modern lasers. Here at the Facial Rejuvenation Clinic, we've specialised in lasers for over 15 years, and we've got all the available types and state-of-art modern equipment in the new lasers, and we've got the expertise and experience in knowing how to use them most efficiently, correctly and safely, and that's the important thing. Lasers are very effective if used correctly, but can cause all sorts of problems if they're not used effectively in experienced hands. The second area of cosmetic medicine is really related to either repairing or preventing areas of skin that are already damaged. And I'm talking about lines, folds, wrinkles, creases, pitted indentations, or volume loss of our skin. And that's where we use the various toxins or natural dermal fillers to repair and also to prevent ongoing age changes in small specific areas. And again, the doctors and all the very trained, highly trained nurses in the Facial Rejuvenation Clinic have a great deal of clinical skill, acumen and experience and expertise in delivering these treatments to their maximum effectiveness and safety. Now, the third and most important aspect, certainly with increasing age in mid-30s and later, is on the most important area, which is in fact over 90% of the volume and amount of our facial skin, and that is the deeper areas where we lose structural strength, support of our skin in the collagen network, and it causes loss of elasticity, increasing lines, but most importantly sagging and volume loss in our face. And here at the Facial Rejuvenation Clinic, we've specialised in the 5 main available modern ways of trying to improve that deeper or subdermal area where the structural strength reduces with age. And we can confidently predict that if people do these treatments regularly under our advice, that we can actually significantly delay and prevent the normal aging features that happen with our skin and the structural strength and appearance of our facial contours. We have the most advanced techniques, not only of applying the various treatment modalities, which can involve radio frequency energy, ultrasound energy, laser energy, physical needle and radio frequency energy, but also the newer and most advanced treatments of injecting directly growth factors into the skin, which can be derived from one's own blood, or in fact even stem cell therapy to maximally enhance new collagen production. So although these 3 categories or classifications of treatments seem simple, they need expertise, you need good advice. Everyone is unique, every person's face is individual, and we offer a free complimentary consultation in a private setting for you to be able to have the correct advice on what might suit you better in terms of effectiveness, long-term maintenance and slowing down and prevention of aging, but more importantly safely and that will suit your budget. So if you want to make an appointment for a free consultation, we'd welcome your inquiry.